Hello, welcome to Dr. Milton's Social Work Show. Happy Monday to you. Even during these extraordinary times, I'm wishing you well. I'm Barbara Milton, a licensed clinical social worker. My pleasure to see you this evening. Today I want to continue the conversation about the global pandemic we're in the midst of, the coronavirus and its life-threatening disease of COVID-19. We have continuing escalating numbers. As of April the 7th, close to 1.4 million people worldwide have been tested for it and tested positive, and almost 78,000 people, souls we've lost to it. In the United States, we're at about almost 400,000 people have tested positive, and we've had 12,238 souls lost to the disease. And of course, that number is expected to increase as the virus makes its way through community spread around our nation. In New Jersey, we have, which is where we're located, 44,416 cases, and we've lost 1,232 people. And yesterday was actually one of the worst days in terms of fatalities since this all started. So it's running its course. It's creating quite a lot of stress in the lives of people. And I want to talk about that stress tonight, and I want to talk about how to cope with that stress. I want to speak to you about what's been working for me and others moving through the stress and the extraordinary time that we're in. And so that's what I'd like to do today, and also offer you some resources if you're struggling with the stress and struggling with coping. So why is this thing so stressful? Well, our entire normal routine has been disrupted. Work, school, daycare, childcare, culture and entertainment. All kinds of patterns have been disrupted. And we're all in a state of isolation right now. That's what we've been asked to do by the Centers for Disease Control. We've been asked to stay home and quarantine. And initially it was for 15 days, and we now know we're here for another 30 days at least. Could, as Governor Murphy said yesterday, the timeline could spill meaningfully into the summer months. I leave that to your interpretation. I interpret it as, could go into July or something like that before we get to normal again. This struggle around the loss of freedom, right? Not being able to go out. It's certainly stressful for a lot of people. Some people are fortunate enough to, just sort of stand in their backyards, or, you can take walks in neighborhoods, I suppose, but, you're supposed to be mindful of the social distancing, and I think everyone's being asked to wear masks at this point. We are getting tons and tons and tons of information, some from valid sources, others not. The conspiracy theorists are out. People are sending all kinds of doom and gloom and end of times kinds of messages out there. There are people who are decidedly and patently decided not to follow the rules that are being laid out as a strategy for us to be safe. There's a lot of unknown. There's a lot of fear, right? Do I have it? Does my neighbor have it? Can I get it if I step outside? Is it on the food that we touch in the grocery store? Is it on the bus that I had to take if I had to go to the grocery store? There's a lot of unknown, right? There's a lot known too. And that's why where you get your information is really important. So I'm sticking with my local officials, my local healthcare officials. It's not partisan. They're not spinning this for political reasons. they're seeing it for the truly, purely public health nightmare that it is, because that's what this is. This is a public health emergency. It's not a Democrat, a Republican, a white, black, a gay, straight, a rich, poor kind of thing. This is a blind a virus that is carried through the droplets in air. So if a person has it and they cough on you, if they cough on a thing that you then touch and then you touch your face, your mouth, your nose, your eyes, you could give yourself the coronavirus that way. It is spread from person to person that way. And we even heard about a tiger recently who's positive for COVID-19, even though most officials say, you know, not possible to get it from the tiger to the human, and the animals are safe. I mean, it was a relief to many people. Um, but we also know that the poorest among us, the most vulnerable among us, people with pre-existing conditions, and that sort of thing, are uh, more uh, at risk for this disease and more at risk for fatality from this disease. And that's something to keep in mind. So a lot is unknown, but a lot is known, and we need to have trustworthy sources. It's sort of shameful that we have federal leadership, at least it seems to me. You could differ with my opinion. It's certainly my opinion, my observation. But it seems like we have a leadership in Washington who's has politicized this. It makes no sense that blue states and red states get different treatment. It makes no sense that, the religious sector is being held to a different standard than the non-religious sector. I don't know. It makes no sense that there are not enough masks and not enough um, personal protective gear and not enough cleaning materials like Clorox, and not enough personal goods like toilet paper and certain foodstuffs, right? Like if you tried to get eggs, if you tried to get some other kinds of foodstuffs, right? Those supplies aren't around, and that makes us have even more and more anxiety, right? And it makes no sense that in the richest country in the world we don't have some of the things we need to fight this battle. Um, I actually went onto the Alibaba website, which is like the Amazon in China, and there's also one like that in Germany. And I just was looking around, and I could see they have Purell, they have hand sanitizer of every kind, Clorox, they have masks, all kinds of masks. And how can they have it and we don't? It makes no sense to me for the richest country in the world. That causes me some stress. You can't see your loved ones right now. That's very stressful. I miss my grandsons. I miss my stepdaughter and stepson and their partners. I miss my family in Camden and Philly. I miss in Texas. I miss my friends in and around my community and in and around, and all my buddies. I miss them. I miss parties. I miss going to the theater. I miss meeting for them for dinner. I miss hosting dinners. I love making meals for big gatherings of friends. I miss it. That social time I miss. Is quite extraordinary how much I miss it. And I miss touching and hugging my friends. I miss high-fiving them. I miss putting my arm around them. I miss saluting them when they're doing good things. I miss sitting next to them and sharing space with them. We had a very nice little interlude yesterday where my stepdaughter had to run an errand, and she was close to the house here, and we hadn't seen them since this started out. They live in Brooklyn, and she was able to come by, and we put our masks on, my wife and I, and we went outside, and she was in the car, and we stood more than 6 feet away from her actually, and it was just sort of both a beautiful thing to see her, and to actually see her rather than on FaceTime and stuff, and to tell her we love her, and to but it was also hard not to be able to put your arms around her, because you love your children, and And that was kind of hard. So, my wife and I had a good cry afterwards because that was like probably one of the hardest things we had to do was to be with someone we love and not be able to hug them. So I know you're feeling that too. This is really, really tough, right? Um, you know, um, there's a lot of grief and there's a lot of loss. That's a very stressful thing as well. We're hearing about the deaths if you're watching the television, and I don't advise you to overload yourself on information or the TV because 24/7 you can be hit with the statistics and hit with these stories that just break your heart of ER doctors and nurses and bus drivers and people famous and not famous who are dying, and disproportionately so the poor and the frontline people are dying, and people with these comorbid uh, disorders, of which I have, cancer. I'm actively fighting cancer. I'm over the age they say to be careful. I'm in the high risk group. Um, you know, um, a lot of grief, a lot of loss that we're hearing every single day. And then you have the fear that it could happen to you. That, you know, is it coming in from the mail that I bought in the house? Is it coming from the food stuff we purchased and we bought into the house? Is it in the air? There's no evidence to suggest that it is. Just you open up your window and the coronavirus blows in. No, it's only if someone who has it, and we could all have it, that's the thing to be mindful of, and they're coughing and coughing, coughing in your direction, right close to you, and their coughs get on you, those droplets of that spray could contain coronavirus. That's why we ask to wear the mask, because that's the first level of protection. That's why we ask to stay home so you don't put yourself in harm's way by encountering people. But there's this fear that it could happen to you or a loved one. We have a loved one right now who isn't feeling very well. And I just want to give a shout out to Bob and say we love you and we're keeping you in lots of prayer and we're rooting for you to get through whatever this is. We're not certain that it's COVID-19, but whatever it is, we wish you well, Bob. We love you. And that's hard too, to see people you love who are not well and you can't be there with them to comfort them. There are people who, you know, whose spouses, whose children, whose mothers and fathers, whose aunts and uncles, whose loved ones go into emergency rooms with COVID-19 and, you know, you're not permitted to go in with them. I had a surgery on March 24th and my wife was not able to come into Memorial Sloan Kettering with me. That's the first time in 8 years she hasn't been at a procedure that I've had. I respect the protocols at the hospital. I knew they did everything they could to keep me safe, but that was hard to go at alone. So I really have so much despair and sadness around those realities. And also, we're in the midst of a political season, and, social workers concern themselves with politics because what we fundamentally believe in is restructuring power so that the poor and the vulnerable among us are provided for. And my God, is this pandemic showing us the seams of desperate and disparity around health care, and more poor people who have other risk factors, but the poverty we're seeing is a factor. The fact that there are states that didn't expand their Medicaid when they had the option to do so under the Affordable Care Act that President Barack H. Obama signed into law. And so those people don't have coverage and they're getting sick. Medicaid is for the poorest among us, mostly children, mostly senior citizens. That's who gets Medicaid, and the disabled, right? So they're the most vulnerable among us. So it matters to me who's making decisions in Washington. It matters who our elected officials are. And we are in the middle of a campaign season, which has been thoroughly disrupted as well. I mean, I don't want 4 more years of a president, and I use that word loosely, who doesn't care about the poorest among us, who vilifies the poor, who vilifies people of color, who stokes fear and division. It's not what we need. Even in the midst of this pandemic, he continues his assault on our country's institutions and democracy, fomenting, you know, what is the word? Chaos, fomenting hate, fomenting divisiveness, telling lies, not speaking the truth, not taking responsibility. That isn't the kind of leader I want. And this campaign has been disrupted, and that is just extraordinary. We've never seen anything like this in modern times. So, for all these reasons, there's an enormous amount of uncertainty and stress. And we have options about how to cope with it. We have positive ways to cope. What are we doing? What does the literature say? First off, it's okay to feel those feelings, right? You don't have to shy away from them. You don't have to numb them. You don't have to go to a bottle or a drug. You don't have to indulge in dangerous and harmful behaviors. You don't have to succumb to it to the point where you can't get out of bed because you're feeling clinically depressed, right? You don't have to succumb to the anxiousness of it. You can fight it. And there are ways to fight it. There are proven ways to fight it. And I wanted to share that. Like, I had a good old cry, yesterday after my daughter left, and my stepdaughter, and we couldn't hold her, and this is my wife's child, and that made her very emotional. And we just had a good old cry. And sometimes you just got to cry. I mean, I've cried a number of times since this has gone down. Why not? It's emotional. It's sad. It's a very sad time. Crying is good. You can release it. You can release it. Likewise, it's also important to minimize the amount of exposure to the information. Take a break from it. Distract away from the reality of it. Don't watch TV 24/7. You know, watch a little bit, get the information, and do something different. Rest. We have you know, parents with kids, my hats are off to you. But I hope you can get rest as well. Everyone should get rest. Naps are good. Good night's sleep is good. Good nutrition is good. These are very important things to do. And then there are things like movement, walking. If you could take a walk in the neighborhood. If not, walk around your own place. Do the steps in your own place. Stretch, do yoga, do some exercise, do some calisthenics, right? Move around, dance, put your music on, jam, 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 do your thing. Um, you know, um, uh, Indulge in some of the good things you can watch. Good movies, comedies, fun movies, uh, any kind of movie that you want to watch. There's tons of good shows out there, tons of good TV shows. It's a good time to read the novel you've been wanting to read. You can write the book you've been wanting to write as well. That's how I'm spending my time right now. I'm writing a book about my mother. Um, you can take this time to deepen your relationship with your significant other and your children, right? Like purposefully and intentionally become more intimate, check in with them, ask them how they're doing, um, do fun things together in your home. Um, with our spouses and our significant others, good time for intimacy, for, making love, feeling each other's presence in that way. Um, getting the hugs that you need. Um, uh, and it's an opportunity coping with improving your spiritual fitness. That's what I'll call that. For me, that means I do a lot of meditation. I do different kinds of prayers and chants. I've been watching workshops on YouTube and on an app that I have on my phone that allows me to tune into a variety of people who are running meditations. And I find that the spiritual domain is really helping me with my emotional and the physical parts of this, right? The the spiritual piece is a way to transfer the fear and worry and to access some of the love and kindness and compassion and tolerance that's really needed right now. Um, so when I'm in that head, I feel more gratitude. I think about all those frontline people who are fighting this in the hospitals, the uh, EMTs, the first responders, people who have loved ones who are sick. I think about them and I'm grateful for them that they exist and they're helping others. I have gratitude for the food that's available to us because it's not magic. Someone had to plant it or slaughter it or make it, and they had to package it, they had to transport it, they had to stock it on the shelves and put it in the freezer and bins in the stores. And all the workers in those stores, and then we get it and we prepare it in our homes. It's not by magic. These are people risking their lives so that we all can eat. I have gratitude for our local, state, and federal government and all that they're doing. I have gratitude um, for my partner, my family, for being innovative and creative and figuring out ways to stay connected, and all my friends. Because we're now doing like phone calls and FaceTime and Facebook Messenger. We have a Friday 4 p.m. happy hour there with 11 or 12 friends. We're having a dance party this Friday at 4 p.m. on Messenger. There's Instagram, there's Zoom. We're having all kinds of meetings on Zoom and free conference call. So there, people are rising to the occasion about being connected because we're human and that connection's vital and important. Um, I'm also comforted by the fact that, in the 80s, we had the AIDS pandemic, and, we lost a tremendous amount of bright lights and souls to that as well. And many of us survived it. And in fact, in each of our stories, our family stories, I bet there's a survival story for you. There certainly is in my African American heritage, and my LGBTQ heritage, in my woman herself, in my disability self. There are long, long histories of survival. You have it in your family too. You have it in you too. We are resilient. We are survivors. We have overcome things. And we're going to get through this too. There's no doubt about it. We already see the evidence for that. The curves are flattening. China's in a better place. Italy is starting to stabilize. Other nations, Canada, other states here are starting to see the curve flatten. So what we're doing is working. And guess what? The earth is benefiting from this as well. We're hearing about the air and water quality being so much more improved. Spring in the Northeast has bloomed. Beautiful trees and flowers growing right now, new growth. And that's really the paradox. While we're losing so much is growth is happening. Babies are still being born. One of the saddest things I saw was the picture of a newborn with a PPE visor on in in the hospital. Like, yeah, but you know what? There's new life being born in the midst of this pandemic, and our lives will continue if we're the blessed, if we're the fortunate ones. Not about blessing or not, if we're lucky enough, really, and but also if we do the work, right? So we have to have faith, we have to hold on, we have to know that we can do better, that we can get through this, but we have to do the things we're told to do, which means we stay home. That's the number one thing. Only go out when you need to. Only for emergency and essential things. We have to wear a mask if we're out in public. This is the newest guidance. So wear a mask. If you don't have a mask, make one out of a napkin or a bandana, double fold it so that you get the proper layering to prevent droplets from coming into your mouth and your nose. Really freaked me out that the Surgeon General of the United States did a do it yourself, a DIY video on how to make your own mask. The richest country in the world. Let that sink in. the highest ranked doctor in our country, doing a DIY video on how to make your own mask. It's shameful, but at least we can do that and save all the N95 masks and other gear for the people on the front lines. Social distance, 6 feet or more. No ifs, ands, or buts. This is not a time to gather and party in close proximity to one another. This is a shared sacrifice for yourself and for our neighbors. Wash your hands, especially after being outside, especially when you handle something from the outside and you bring it into the inside. That means things like your cell phone and stuff too, right? That, after coughing or sneezing, coughing into your elbow, but still, wash your hands. Keep your hands out of your face. Wash, wash, wash. Wash them as frequently as you can. My hands have never been so clean. I'll tell you, I'm really washing a lot. 20 seconds with soap and warm water. And look, if you're having a hard time coping, there's help. You can call the Substance Abuse and Mental Health Administration, 800-662-4357. They have a 24/7 hotline, give you education, support, connect you to treatment and help. I will put that up for folks so that you have that number. And remember, we have a history of getting through things when we pull together. And if we're one of the lucky ones, we will. And what improves the chances that we can survive is if you do the things you're told to do. That you have faith, you can pray, you can have hope, and all of that, but you got to do the things we're being told to do. Do the things we're asking you to do. That it's not just for you that you're doing it, it's for the vulnerable among us. It is for that grandmother, that baby, that sick person in your neighborhood. We're asked to do these things so that the people on the front lines have the resources they need. We're asked to do these things so that we can flatten the curve and reduce the amount of transmissions of this community spread. We are all dependent on each other. A cough in China created a pandemic around the world. Okay? That's how closely we're connected and how much we're dependent on one another. My well-being is intrinsically linked to your well-being, and I'm going to do my part, and I hope you do yours too. So check out the cdc.gov website. Love the people you're with. Deepen your relationships with your family. Look out for one another. Be careful. Do the things you're supposed to do. And we're going to get on the other side of this. And I pray that let it be so. Thanks for tuning in.